Edward Lee, part 2 of our wart excision procedure. Patient returns today. She had her dressing clean, dry, and intact, already removed, and now we can see that our plantar verruca sites have blistered. So we see the separation of the dermal layers. And what we're going to do is using either a 15 blade or soft tissue nippers, we're just going to excise the areas. Now before we excise, we're going to use just 1% lidocaine for a local block under each lesion. Real slow. You should already start feeling some relief. Good. And you can see the blanching of the skin around the lesion, letting us know that the local is getting into the area. We'll just do a standard V block. Okay. Once again, blanching near the lesions. I like to see complete blanching around the lesion. I'm just going to use the soft tissue nippers. First we'll just puncture. Let's see the serous fluid exiting. And we're just going to cut around the lesion in its entirety. Remaining portion, any remnants of the viral particles. Make sure you tear at the base completely. And just add some lumicaine to achieve a little hemostasis. And then we'll come back here after we excise the remaining 3 for our applications of phenol. Okay. The patient is 100% comfortable. And we'll continue to just excise the plantar lesions in its entirety. And just go all the way around. And we'll see how the warts are completely excised. Comes out just very cleanly, separated from the dermal layers. Make sure we get all of the remnant particles. And the last one, the tiny one on the corner here, you want to make sure you see the exiting of the serous fluid. Make sure that we are down to the appropriate layer. And then we get that full thickness of the plantar lesion. And then sometimes we'll go back just to clean up some of these edges. And now we're going to do our chemical cauterization of the base with some phenol. I will do typically 2 applications, 30 seconds each, to the bases of each of the plantar lesions. So we have our phenol, and we're just going to apply it to the base. And we're going to roll and count about 30 seconds for each of these bases, making sure we get the central aspect of the lesions, but also the surrounding areas to make sure we cauterize any remnant viral particles. We're going to neutralize our phenol with 70% isopropyl alcohol, so we'll just flush each of the areas with copious amounts of isopropyl, 70% alcohol, making sure we neutralize any remaining phenol into the sites. So the sites will just be dressed with a topical antibiotic and with some dry sterile dressing. patient will keep that dressing on for 24 hours. Next day, the patient is allowed to take the dressings off, shower as usual, just cleanse the areas with soap and water. Make sure to rinse very thoroughly, make sure we get all that soap water out of there. And then the patients can do some Epsom salt water soaks. And after the soaks, make sure we pat dry, and then just continue with a topical antibiotic, and then a Band-Aid or dry sterile dressing to cover the areas. And then the patients will continue to do the same type of dressing change every day for the next 2 weeks. And then at 2 weeks, we'll follow up with the patient again. Just make sure everything is healing as planned, no signs of infection.